Thanks very much. So, well, before you come and start a talk, the first thing you don't want to find out is that both your colleagues have written extensive notes, and I came here tonight thinking, I just really wanted to try and talk with you about my experience and what had gone on. And then when I saw the room and the size of the audience, I started to panic somewhat. So, bear with me. But yes, as you said, I was originally a general nurse, and I loved general nursing. I loved the rigour of it. I liked the sort of obsessive rituals involved in doing an aseptic technique. And I loved kind of making people feel better. And it was fairly easy much of the time in general nursing, and you often got a box of chocolates and were made to feel that you'd done a good job. But during my training, I also did a secondment at a place called Hellingnigh Hospital, which is not too far from here. It's somewhere in Sussex, I think. And I became absolutely fascinated with the human mind. I became so interested in what caused people to become mentally unwell. And of course, in Hellingnigh at that time, there were people who were very seriously unwell. But I really felt, after I'd completed my general nurse training, that it was sort of in my mind that I was going to follow that. And I did. I went to Springfield Hospital in Tooting, South London, and I trained as a psychiatric nurse, as it used to be called. When I was there, I witnessed ECT treatments, which I found somewhat shocking at the time, though I was reassured that it worked, until I read a small research article which said that there was one hospital where their recovery rates from serious depression were working well, and then they found the machine wasn't working. So whether or not there was something around the experience of it, feeling that you'd been given it, I don't know. But I soon learned that I felt in order to help people kind of find themselves again, it wasn't just about medication, it was about trying to help them think about themselves, what their sort of emotions caused them to do and feel, and how their relationships were impacted by what was going on with them. And really that's the way I kind of worked my life, mostly in the NHS. I did a little bit of work, and it was quite interesting, in the counselling, the occupational health department at the BBC for a while. I'm glad I'm not there anymore. But anyway, it led me to then finding psychotherapy, because I thought I was working as a community psychiatric nurse, and I was working on inpatient units. I worked at an eating disorders unit over in Wimbledon and at the Maudsley Hospital. But then after a period of about 10 years working in Croydon as a psychiatric nurse, working with mothers and babies, I became fascinated by that relationship, and I went and started doing some training at Tavistock. And that was how I came to psychoanalytic psychotherapy. It's a mouthful, but it's Freud and all that. That it's sort of in there, but it's not really him, because I became fascinated with a woman named Melanie Klein, who I felt really described the human mind developing in a way that made sense when you came across people with schizophrenia or psychosis or serious depression, or borderline personality disorder. And I'll come back to that. I'm not going to give a clinical lecture, by the way, but I just kind of wanted to give this a bit of background to what kind of brought me to the Tavistock. I took a job there in 2003, mainly working in the adult department, and I was going to deliver education programs, mainly to nurses, but also introductory courses for counselling and psychotherapy. And I love that. I love that job. I love working with people and introducing people to the ideas about the unconscious and psychotherapy. But then a little part-time post came up, and it sounded really interesting, working in the Gender Identity Development Service for children. I applied and I got the post, and I started to work there. And I kind of assumed that unit was going to work with the children in the same way that the rest of the Tavistock and Portman Clinic worked with children, worked with any patient, which was holistically, trying to find out about the person, not using medication, and really getting alongside your patients in a way that means you're really trying to understand their world, so you're accepting what they tell you their world is and what their thoughts and emotions are. But then you use your own sort of expertise in a sort of separate mind to then have a conversation with that and to help them think about it. So it's about firstly identifying with their pain, their difficulties, but then also allowing yourself to explore it and have your own thoughts. Now, when I first joined the team, I remember going to a clinical team meeting and we got presentations of children, and it wasn't anything very different from what I'd heard before in other units, adolescent units at the Bethlehem Hospital I worked in, and the anorectic unit at Atkinson Morley. Anyway, off I went. I took on a case or two, and I expected my colleagues were going to be doing the same. But I remember this 16-year-old boy was presented to the team. And one thing I should say is back then, they took referrals from the whole of the UK. It was a Tier 4 service. We got less than 100 referrals per year from the entire UK. Most of them were boys, not all of them. I did treat a few girls, but most of them were boys. And most of them did have parents who said this has been sort of fairly obvious and it's been around since their early childhood. But I heard the case of a 16-year-old boy. I won't give details about it for obvious reasons, but he had a complex background. There were all sorts of things going on for him, both within his family and within his school and his relationships with his peer groups. And he had some mental health issues. About 2 months later, 3 months later, I remember him being presented again by the colleague who'd taken the case on. And she said, I'm going to refer him to, it was the Middlesex Clinic. It did go on to be University College Hospital, but at that time it was Middlesex. And she said, I'm going to recommend him for hormone blockers. And I thought, he's not been seen that long ago. And I said, Julie, can you tell me how many times you've seen him? And she said, just 4. So 4 hours. You've seen him for 4 hours? Yes. And it was just the most horrifying, heart-stopping moment. I don't know if any of you work in sort of clinical areas, and I'm sure it happens in other professions, but you hear something that feels so wrong, and it made my heart beat fast. And then I started to pay more attention, because I kind of assumed my colleagues had been doing what I was trying to do. It's what I described before. So then I started to listen, then I started to explore a bit more. I tried to speak out. I was told by my senior colleagues on the team that I should use the gender preferred by the child when I was replying to a GP who'd made a referral. And I had discussions and debates about it and said, but surely the GP's referred a biological boy or girl and I should reply. And I was told, well, the patients might not like it, or we might get sued. And then I found out that the 2 senior people in the team used to go and have meetings with mermaids very regularly. And what I realised, and I think I can't nick this phrase from my husband because I've heard him use it before, but it's such a good one, which is I've got it the wrong way around, which shows it's his. Anyway. In other words, what was going on is that the charities and the external organisations were yanking the clinical chain. You know, they were getting us to do things and change our methods and what I felt should be our clinical approach to one that suited them. Time went on, and I don't want to consume too much time explaining the sort of various arguments that I started to have. I was joined briefly by a colleague, you might have heard of him, Dr. Az Hakim, who's also written a book about working with adults in this issue. But he joined me, and he was pretty vociferous, and he was a psychiatrist and a gay man, and he was pretty outspoken in the team and fairly forthright. I had been a bit more, I think perhaps held back, a bit more junior at that time. But it still got us nowhere. Then he moved on because they work on rotation, and so I decided that I got nowhere within the team, so I decided I was going to go and talk to someone. And my husband worked, and I'll come back to him in a minute, he worked in the adult department. He was a senior clinician in the adult department, and I asked him, he'd been there a long time, I said, who should I speak to? Because he knew I was very, very troubled. And he put me in touch with the clinical director at that time, and I went and had a conversation with her. And at that time, the Tavistock took it very seriously, and Dr. David Taylor made a report. He investigated what was going on, he looked at the notes, he talked to the staff, and they got in some external medics as well to conduct the interview. So it was done carefully and thoughtfully. And he wrote a report, which I never saw, and it's so interesting because I worked in the team, and we were fed back the results by our two senior, I'm going to name them actually, it was Dr. Domenico Di Cellier and Dr. Polly Carmichael was the number 2 at the time. And we were told it was all a bit silly that, you know, it was very irresponsible and they weren't quite sure who had gone and whistleblown. I think they knew it was me, but, you know, the silly person that went to whistleblow, and it wasn't very responsible. But anyway, we were going to be overseen by the adolescent department, and they were going to just examine the work that was going on. And that was really all I remembered about that report. Wind forward a few months, nothing really very much changed. There was a conference held in the Tavistock. They used to regularly hold quite important sort of international conferences. People would come from all over the world to come to the Tavistock. They were fascinating. But this particular one was on gender dysphoria and transgender issues. And I remember the opening speech was one that said, this isn't really anything to do with mental health, and the crowd cheered and clapped. And then he said, and in fact, we shouldn't even be having this in the Tavistock, which is a mental health trust, more clapping. And I think at that point I thought, I've gone as far as I can with this, and I felt I couldn't be a part of it. I didn't want to be a part of transitioning children or working in a team where I was going to be asked at some stage to do that, so I left. Stayed on my mind. I'm aware my time is going fast, so I'll kind of get going with it. What happened was, I left, I continued to work at the Tavistock until I retired a few years ago. My husband retired a few years ago as well. Meanwhile, Dr. David Bell, you might have heard of him from various things in the press and through the Stonewall report on the BBC. He was contacted by now, this huge team, this enormous amount of referrals, over 3,000 referrals per annum. About 10 staff contacted him and whistle blew again. Same concerns, same worries. Children were being medically transitioned without sufficient assessment, without exploration. There were comorbidities. Some of them had serious mental health issues. As you've said, a lot of the children had either autism or were on the spectrum, neurodiverse in some way, so their thinking tended to be more black and white, and they felt they kind of found an answer to feeling out of the peer group, feeling at odds with life, with themselves. So we moved on. Dave Bell wrote a report. My husband by that time was a governor. He tried to get the Board of Governors to take it seriously. The medical director was appointed to make another report. He made a report, but he only fed back his findings and not the accounts that had been taken, the verbatim accounts that had been taken from the whistleblowing staff. So in other words, the Board of Governors did not hear what the whistleblowing staff at that time felt. Wind forward again, by now it's getting in the press because of course when my husband resigned over this matter, he couldn't get them to listen, he tried very hard, he resigned, Radio 4, press. we were invited, well I wasn't, Marcus and Dave Bell were invited, along with Stephanie, which is where I first encountered Stephanie's fantastic work. But we went to the House of Lords when we met with Lord Mooney, and he held a sort of meeting, didn't he, where various people spoke about their experiences. A representative from the Tavistock stood up and said, I just want to say, I'm here to say that we do very careful assessment work. All of our children are seen for a very long period of time and in depth before they're recommended, at which point I have one of those, yet another sort of moment where you think, that's it, I've got to stand up and speak. And I stood up and said, look, I know for a fact that isn't what happened because I worked there and that didn't go on. And in a sense, I outed myself in that moment. And then I'm sure you all know there was a lawyer there. He had a parent who was very worried about her autistic daughter. He asked Dave Bell, Marcus and I to meet with him. Could we help the mother take a judicial review? And for some mad reason I said I would. And so I put together with Mother A the evidence for the judicial review. One of the people I contacted was Kira Bell. Once I'd read her account that she submitted for the judicial review, she and I and the lawyer had a discussion and felt she was the person who could really take this forward and create a case that would get into the public's mind, which I think she did brilliantly. And I'm going to stop there because I know we've got discussion, and if people want to ask questions about that. But the one thing I'd say is, like you, I think I never wanted to be a whistleblower, and I think we kind of come to it in different ways. It was very nerve-wracking. I wrote a book because I thought if we win the judicial review, my husband and I, we wrote a book, but we thought if we win, we've got to offer a model, we've got to offer something for people who are saying, well, what are we doing for the children? It's not the only way. I'm not saying we've got all the answers, but we've written something which tries to think about children from a holistic point of view and offer an understanding, and I'll gladly talk a bit more about that if people are interested in kind of some of that theoretical work. But anyway, I'll stop there for now.